Name is Junheng, and I'm a postdoc researcher now currently at Imperial College and King's College London in the UK. I was trained as an engineer, and I started neuroscience research during my PhD, where I worked on computational models of sleep and also neuromodulation in sleep, things like that. And my research still lies in the same vein to utilize advanced computational tools to understand more about sleep. In my PhD, I was trying to find some good sleep dataset sources for the analysis of the problem that we want to ask. For example, how the brain falls asleep. For example, within this paper we just published. So we just need to find a good data set, of course, which is big enough. And also it's good enough with good data quality that could support such analysis, and of course becomes the first option. There it's just having many big data sets, big sleep data sets that is there, and which contains very rich data, and I just applied to a few, and it seems working pretty well. So a lot of the data was great. In the paper, we only used one data set that we focused on. Essentially, we used data to uncover the brain dynamics of falling asleep. But we also applied for several other data sets, and I think the richness of the data also provides additional power for us to answer big problems, especially the homogeneities of sleep dynamics between across the population, also the heterogeneity of the difference in the sleep dynamics between and across the population and things like that. So I think the richness of data was really providing the opportunity, and we are doing research in the direction also to uncover such things, that how could we explain the differences, and also the rich demographics data within the sleep data set are also very helpful for us to work on these different types of questions, like how sleep dynamics are shaped by those things. We uncovered that the falling asleep dynamics is a nonlinear process, which we model as a bifurcation. So theoretically, it has several utility values, as we demonstrated in the paper, that it has the potential to predict the falling asleep process in real time. And there's also such a model so recaptures and redefines the falling asleep process outside the traditional sleep staging framework, which is very commonly used in the current clinical setting. So what it means is that it could imply potentially a new way for diagnosis of insomnia, of sleep onset insomnia, for example. And also in another vein, that such a model could also help us imply the potential the other sleep disorders that people might have, that is difficult to uncover utilizing the traditional sleep staging framework, for example. And also the real-time prediction power also provides us the potential to to use that in some kind of monitoring scenarios, that when we need to monitor sleep, for example, in certain cases, or in cases where high risk jobs are taking place, that we need to monitor sleep. For the clinical values, most of them is of course about the how it can be translated for disease detection, and sleep disorders detection, things like that. Aside from the very obvious direct clinical meanings before, in the general research scenario, such a framework could help us better understand the mechanisms of sleep switching, for example, and also could help us develop new targeted drugs for modulating, for example, even just falling asleep. Can we help people fall asleep faster, utilizing different drugs or neuromodulation approaches, targeting the biomarkers or the features that we identified in the paper. And I guess that would be a very broader implication to the population health in a longer term, that we now get a better understanding of how it works in general, like how sleep unfolds, and it will definitely lead in a longer term lead to a better understanding of sleep itself, and of course targeted therapy for the population health. So NSR is really very easy to use and open data sharing platform. I think in any case, if scientists, if anybody is interested in working with any data on the platform, they should definitely try to to justify and apply with their scientific questions, like what they want to answer. And I don't think there will be any obstacle in obtaining the data. If we have if we have good reasons why we want to use the data, for example, and to uncover new things about research. I think yeah, in general, anybody should, I guess, should be welcome to try, just apply for any data they want, with an SR.